My name is Ian, and I'm from the European Environment Agency in Copenhagen, and I lead the pollution and health team at the EEA. So I was asked to come along today to talk a little bit about our recent report on Europe's environment 2025, which is quite a broad-ranging assessment, and then more specifically about some of the conclusions in relation to environment and health in that report. So I hope you find it interesting. And these are the sort of visuals that we use for our report. But the first thing I wanted to share with you is a question that you might be asking yourself, and what is the EEA? Some people are not familiar with the European Environment Agency, and they think we might just be a bunch of people that are interested in the environment, which is true, but we're also an agency of the European Union. And there's 300 of us working in Copenhagen looking at the European environment. Now, what do we do there? Well, we're not a regulator. We don't develop policies specifically, but what we do is we produce knowledge on the environment that we use to inform policy. So we work very closely with the Commission in Brussels, for example, in terms of informing their policy decisions, and also using that knowledge to assess progress in relation to existing regulations, for example. And how do we do that? Well, we collect a lot of data from all of the EU countries, and we try and turn that into knowledge that can inform these processes. And within the agency, we have 3 different thematic departments, one on environment, where my team is, one on climate, and one on sustainability. And I also just want to acknowledge a lot of the content that you'll see today in relation to environment and health is put together by my wonderful team that are working in the units. So we have a lot of experts on different topics. And you can see the areas that we're working on in relation to environment and health. And we also have 7 new people that will be starting, which shows the emphasis that we're placing on environment and health and understanding better the links between environmental stressors and health and well-being. So, for example, we're working on air quality and air emissions. We're building a lot of new data on chemicals and chemical exposure as well. We're working on human biomonitoring through the PARC project, which is the Partnership for the Assessment of Risk from Chemicals. So we've got quite a few different things going on, and One Health, as was mentioned by Ellen as well. We're part of an EU agency, cross-agency task force on One Health. So that's just to sort of promote the people who are actually doing the work a little bit. But now on to the Europe's Environment Report. And if I can ask you maybe for a moment to travel back in time to 1995, when we were all a bit younger and more innocent. And I was in Trinity College working out what engineering actually was. And I see Bruce down the back who helped me a little bit with that. And back in 1995, some of you were possibly doing the Macarena badly. And this was also the year when we published the first of our Europe's Environment Report. So that was just after the EEA was formed. And this is one of the key things. So this is stated in our founding regulation that we have to produce this assessment every 5 years. When I look back at that report from 1995, I see quite a different perspective on the environment. It mentions climate, but there's not really very much about climate mitigation or adaptation. And I think there was a failing to understand the sort of existential threats that we were going to be facing as our eyes have been opened over the last 30 years, for example, in relation to the impacts of biodiversity loss, of climate, and of the impacts of pollution. So a lot has changed, as Laura has mentioned also, over those years. Now, the report this year itself is split into 3 main sections. So we have a sort of a main classic, I suppose, PDF report. We don't print them anymore. We have what we call thematic briefings, which address specific topic areas and assess, based on a color coding, the past trends and the future outlook. So, for example, there's 6 of these thematic briefings on health-related topics, so air quality and health, water quality and health, and, for example, chemicals and health. And we look at what have the past trends been and what the future outlook is. And I'll present some of those findings over the next few slides. A new element that we brought in is these country profiles as well. And these are actually, in terms of on our website, these are probably the most visited areas, because often people are not really interested in what's happening in Europe, but what's happening actually in their own countries. So we've got a lot of visits to these country profiles, and I'll just show you part of what the country profile looks like for Ireland. And one of the key things here is that we did this in collaboration with the countries. So for example, the EPA was very much involved in developing and supporting this country profile. So I'm not going to go through all of these, but here we highlight certain areas, and for example, where acceleration may be needed, where we're on track, or where we're going in the wrong direction. So if you look, for example, at the final energy consumption figure in the top right-hand side there, you can see that it's highlighting that we're in danger in Ireland of not achieving the target unless we accelerate a little bit further in terms of reducing energy consumption. And then in the bottom middle, for example, you can see the share of renewable energy in the final energy consumption. And you can see the target there is 43%, and we're quite a bit below that at the moment. So it highlights some of these areas where improvements are required in all of the countries. And now I'm gonna start off with one of the sort of main conclusions about the report, and this links in a little bit to what Laura was talking about as well, and the importance of nature. And really it's around the fact that nature underpins everything that we want to achieve, and everything that all of the policies that we want to deliver on. So in the center of this you have people, and then the blue area outside that essentially represents our basic needs, for example, in terms of health, in terms of livelihoods, prosperity, social fairness. And then outside of that, in the yellow and other various shades of yellow, you have the production and consumption systems that support those basic needs. So for example, our needs for food, the industry that provides some of the products that we need, the built environment that provides shelter for us, warmth, heating, cooling, etc. And then outside of this again, so the outer blue one is the environmental assets. And I specifically refer to them as environmental assets because that's what they are. These are the assets that underpin all of those production and consumption systems that underpin our health and well-being. So it's not just that nature is essential for health, it's essential for our society, it's essential for our economy, it's essential for all of the products that we're producing. They rely on raw materials from nature. So these environmental assets can be depleted, and without them, well, things won't go so well. So the key message is that nature is not a luxury, it's a necessity. And I could stop there, but I'll go into a little bit more detail. I'll go through some of the main topic areas, and then I'll specifically focus on environment and health. So here we talk about biodiversity and ecosystems, and we have some subtopics within this. And what we show here is the past trends and the future outlook. So the yellow color means it's a mixed trend. Red is where we're going in the wrong direction, it's a negative trend. And the blue or green, it looks green to me, some people say it's blue, but that's where there is a positive trend. So you can see, for example, that really when we talk about biodiversity, that the recent trends and outlook are very negative, and the state and outlook for biodiversity is quite poor. In some areas it's improving marginally, but it's still quite a mixed outcome. And just to pick one or two examples, because again, I'm not going to go into too much detail, but on the left, you see that 60% of species, and on the right, 80% of habitats are in poor or bad status. 80% of habitats. You know, for me, that's quite shocking when we look at the state of these ecosystems and resources and the level of damage that has been inflicted on them. And when you see there, for example, on the right-hand side, that nearly 3/4 of companies in the economy are dependent on some of these ecosystem services. For example, water or raw materials that we use in production and consumption. So again, highlighting that link between nature and delivering our quality of life. Just to mention briefly then resources or water, and here you see seasonal water scarcity figures. And you can see that the south of Europe is particularly impacted, but in fact across Europe, over 1/3 of citizens are suffering water stress at some point during the year. And this also affects in particular areas where there's intensive agriculture. So you see the north of France and parts of Belgium where they are particularly dependent on water for production of food. And again, we see hotspots there of water stress as well. And where is all the water being used? Well, the biggest one here actually, as you can see, is in production of food in agriculture. So again, the quality and quantity of water is critical in terms of providing, being able to provide sufficient food to feed the citizens in Europe. So that was just a couple of points in relation to biodiversity. I'm going to run through climate change as well. So again, we have the same format here where we look at the past trends in relation to certain areas and then the future outlook. Things are a little bit more positive than in the biodiversity side of things. And you can see that because we have been making progress in terms of, for example, reducing greenhouse gas emissions, we have been making progress on reducing emissions of ozone-depleting substances, but still it's quite a mixed picture. And if we look, for example, here, we can see that we are progressing well in Europe in terms of reducing greenhouse gas emissions over the last 20 years. And we will get close to meeting the targets that we have for 2030, but we won't achieve them fully. So progress is there, but we're not quite moving things along fast enough. But of course, the elephant in the room a little bit is the global picture. And Europe can't operate in isolation when it comes to climate because all of these things are happening on a transboundary scale. So you see that globally greenhouse gas emissions continue to rise. And the key thing here is that the EU needs to act as a global leader in terms of leading the way and promoting greenhouse gas emissions on a global scale because we can only do so much within Europe. So where are we achieving these greenhouse gas emissions? I won't go into a lot of detail here, but historically the main sources of these have been the two areas on the right, industry and energy production. And you can see this is also where we are achieving the biggest reductions in greenhouse gas emissions. But if you look at, for example, transport in the center there and agriculture just towards the right, the greenhouse gas emission reductions there have been fairly modest. And actually transport in 2030 will probably be the biggest source of greenhouse gas emissions if the current trends continue. So again, there's a lot more that can be done there in terms of achieving larger reductions in greenhouse gas emissions. And the next, I just want to talk then briefly about some of the findings in relation to circular economy. This really wasn't something that was mentioned very much in the 1995 report that I mentioned, but it's become very clear that the production and consumption and the linear way that we produce and consume goods is completely unsustainable, and that we need to move much more towards circular design and reducing our consumption. Europe and we're part of Europe have some of the highest material use in the world. Obviously, the US is astronomical, but we're not doing very well either. And this is something that we need to address. And this is a little bit of a complicated graph on the left, but if you just look at the blue line, this represents the total circular material use rate in Europe. So in other words, it represents how we're sort of reusing materials at the end of life, for example. And you can see that over the last decade, we've practically made no progress in terms of actually increasing our circular material use rates. And it's a very difficult area because, for example, often it's cheaper to produce virgin plastic than to recycle plastic. So we need to really address some of these issues so that we can encourage greater circularity. I just show on the right there, it's difficult to see, but the circular material use rate for different countries. You can see Ireland is quite low. Part of this is related to the sort of types of production and consumption activities that we have here, but I think it's clear that there's opportunities to do more in terms of increasing circularity in Ireland, because at the moment in Ireland and across Europe, it's not sustainable in terms of the consumption of materials. And again, we're taking a lot of these raw materials from nature. And this is going to have a long-term impact. So let's get on to the main thing that I was asked to talk about, and I'll give you another 15 minutes if you can bear with me on environment and health. And here again, we have quite a mixed picture when you look at some of these issues in relation to, for example, emissions of air pollutants, environmental noise. We're failing to make progress in quite a few areas, and some areas are actually getting worse, for example, in terms of the relationship between water pollution and health. And I will now give you a few sort of high-level details on the links between these environmental risk factors and health and well-being. So on the left, so Laura mentioned already that 10% of premature deaths in the EU 27 are driven by exposure to environmental pollution. And on the left, you can see the number of deaths, premature deaths annually that are related to environmental pollution. And the specific non-communicable diseases that are resulting from this. So you can see that cardiovascular disease is the highest. And on the right, I just highlight that we've identified that around 30% of all respiratory deaths in Europe are related to environmental exposure. Around 1 in 5 deaths related to cardiovascular disease are linked to environmental pollution. And about 10% of cancer deaths are also linked to environmental pollution. But one thing that they all have in common that we can say about all of these environmental stressors is that the premature deaths and morbidity that are linked to these environmental risk factors are largely preventable. So by reducing pollution and by addressing inequalities, that we can prevent a significant number of deaths related to environmental pollution. And here we see an example of how regulation has worked. So this is the number of premature deaths related to PM2.5, so these are fine particles, since 2005. And we can see that because of the regulation of emissions of air pollutants and other protective measures for citizens, that we've reduced the premature deaths by about 50%. Now we're still at around 200,000 premature deaths annually, so it's significant. But here we show that when we put our mind to it and when we take action, we can actually do something about these issues. And we should meet our 2030 target in Europe to reduce premature deaths by 55%, which is good. But obviously we shouldn't stop there. But obviously it's not just deaths that we should be worried about, but the impact on morbidity. And here, I'll try and explain this as easily as I can, but here we see diseases, a range of diseases related to 2 air pollutants. If you look at PM2.5 at the top, essentially the yellow bit represents the burden of disease related to morbidity. So people living with the effects of stroke or cardiovascular disease or asthma, for example. And you can see that for a number of these diseases, that yellow part is quite significant. So we have the impact on the overall burden of disease, from example, for asthma is quite significant. So it's not just about premature deaths, but it's about the impact that these pollutants are having on the quality of life. It's also about the impact it has on the vulnerability of these people, because there's a lot of evidence to show that where people are exposed, for example, where these people who are already ill are exposed to extreme heat or extreme cold related to climate change, that the outcomes are much worse. So again, if we can prevent this pollution, make people more resilient, we make people, then they're better able to deal with the impacts of climate change as well. And one of the things that in the EEA that we're really trying to promote at the moment is that we want the healthcare sector to be an advocate for a clean environment. We want them to be aware of the preventive role that reducing environmental pollution can play. We want them to be promoting the health benefits of spending time in nature, etc. So we're really working to engage with representative bodies and the medical sector across Europe to do that. And the next thing that I want to mention is chemicals. And what you see on the screen here is the results of human biomonitoring studies across Europe. And essentially you see the percentage of people sampled that had levels of these chemicals above safe guideline levels. And the one that obviously, this is only a very small selection of chemicals. And you see PFAS, Laura was right, I'm going to mention PFAS. PFAS is in there, but again, there's thousands of PFAS compounds and we're measuring maybe a handful of them. So this is representative of a small percentage. You can see that the one that jumps out maybe is bisphenol A at the bottom, which is regulated now and is more or less banned in Europe. But recently, the European Food Safety Authority reduced the tolerable daily intake of this by a factor of 20,000 because it was originally identified as an endocrine disruptor, but now they've identified that it actually quite significantly impacts on the immune system as well. So that resulted in the tolerable daily intake reducing by a factor of 20,000. And you can see here I've just some additional information on this in terms of the levels, the percentage of people in each of these countries who had bisphenol A above these safe levels. And when you take into account issues around limits of detection, etc., I mean, essentially everybody that was sampled had levels of this bisphenol in high above the safe guideline levels. Now, the yellow line on the right shows that it's reducing over time, and that's because, again, it's been regulated. And one of the good things, if I can say it, about bisphenol, this chemical bisphenol, is that it's not persistent and it doesn't bioaccumulate. So if you regulate it, it will reduce over time. But unfortunately, we can't say the same things about other pollutants like mercury, which if they get into your body or when they're in the environment, they'll stay there for a very long time. So a mercury that's in the environment now is going to be still there in 1,000 years, and it won't really have reduced very much. So there are some chemicals are easier to regulate than others. And it's very difficult to see, but on the graph on the right, there's a white line which represents another chemical called bisphenol S. And this was the chemical that was used to replace bisphenol A when it was regulated. And that's slowly increasing. The levels of this are slowly increasing in people. And we now know that bisphenol S has the same health effects as bisphenol A. So this is what we call regrettable substitution. And this is something that we need to avoid. And a little bit more on PFAS here. So again, what you see here is this is measurements in rivers, lakes, and coastal water bodies. And you can see the percentage of these water bodies where the PFAS, well, this is only from one of those 10,000 PFAS, but it's one called PFOS, which is also regulated and has been banned for the last 10 years. But these are recent measurements, and we still see that, for example, 35% of lakes, 60% of rivers, and 3/4 of coastal bodies have levels of this PFOS above the EQS. And the key thing here is that this EQS is not set to protect the environment, it's set to protect human health. So we look at the most sensitive endpoint, and then the environmental quality standard is set there. So again, it's not a great numbers. I also just put in some numbers for Ireland. In 2022, 51 rivers and lakes were sampled, and only 3 of them were above the EQS. So things seem a little bit better here. I'm conscious of time, so I'll keep going. But I just wanted to mention that yesterday in the Parliament, there was a plenary vote on a new regulation called the One Substance, One Assessment regulation. And the EEA will have a role under that in terms of developing an early warning system for chemicals. So the idea is to stop future PFAS chemicals happening, because PFAS were invented in the 60s, and now we're only really putting in place measures to prevent them. So the idea is that we publish an annual assessment to identify early, using various methods like non-target screening or other methods to try and identify those emerging pollutants and stop them earlier. And the bottom part here is I just wanted to mention as well that the regulation also provides for an EU-wide human biomonitoring assessment, because many countries are not doing human biomonitoring, and it's really, really powerful in terms of understanding the burden of disease that chemicals are placing on our bodies. So for us, this is a really positive thing, and the EEA will be in charge of coordinating that with the Chemicals Agency and also collecting the data. And just to talk a little bit about noise. So around 30% of EU citizens are exposed to noise levels that are above safe levels, so transport noise in particular. And this, as Laura mentioned, noise is not just a nuisance, it has quite significant health impacts. And for example, it results in 50,000 additional cardiovascular cases per year and 66,000 premature deaths annually. It also has a disproportionate impact on children, and we know, for example, that it significantly impacts on where children are exposed. It has impacts on their reading ability, it results in behavioral issues, and it also leads to obesity as well. So again, this is the same with many pollutants, that the limits that we see are set to protect the general population and adults, and often we don't take account of the significant impact that it has on children as well. And unfortunately, because noise has been a bit unrecognized, we're making no progress in terms of reducing noise levels in Europe. And I just have some data for Ireland here. And if you look at this map on the left, what we're trying to do here is we map green spaces in European cities, and we identify how much of those green spaces are actually quiet and can be adequately enjoyed by people from a leisure perspective. And for example, in Dublin, we see that about half of the green spaces are not affected by transport noise. And that means when we analyse this a little bit more, that we can see that around 1 in 3 of the population in Dublin have access to green and quiet spaces within around 400 metres of their home. So in other cities it's higher, in some cities it's lower, but I think only the fact that only 1 in 3 people have access to green and quiet spaces is, I think there's opportunities to improve that as well. Laura also mentioned this idea of inequalities and exposure, and this is something that we're working on quite a lot in the EEA at the moment. And on this graph, you can see this represents population exposure to PM2.5, this air pollutant. The top line, the green line, is the 20% of the population, the 20% who are the poorest people in Europe, and the blue line is the 20%, the richest 20% of people in Europe. So you can see that over the years there's a consistent gap in exposure between those two cohorts. And what we're trying to do at the moment as well is develop a 1 by 1 kilometre gridded data set for the whole of Europe that looks at exposure to air pollution and noise and compares it to other factors, for example, like employment status, country of origin, age, gender, and income. So we'll hopefully be developing much more granular maps that show within urban areas how you have significant pockets of unequal exposure to pollution, air pollution and noise as well. So they'll probably be published later this year. And I can see that I'm getting towards the end. I just wanted to mention a few areas of work that we will be publishing on in the next while. So one is around mental health. So we're producing an assessment looking at how environmental pollution actually negatively affects mental health. And the report that we'll publish at the end of November on air quality for the first time will highlight and quantify the link between air pollution and dementia as well. So we want to sort of highlight also the benefits of nature in terms of protecting mental health. We don't really know much about the burden of disease from chemicals compared to air quality, so we're working on that. I mentioned inequalities already. In terms of cardiovascular health, the EU are developing an EU cardiovascular health plan, so we're supporting that and working with the Commission at the moment. So it's a follow-on from the previous Beating Cancer plan. We also want to identify in a bit more detail who's actually paying for pollution. We have this polluter pays principle which is enshrined in EU law, but in many cases the polluter is not paying. And we know, for example, we've quantified that the health costs of industrial pollution in Europe annually are somewhere around 300 to 400 billion euro. And again, they're external costs. They're not being paid for by industry. So we're working on that, and then how industry can transform to address these issues. So it's all been quite negative, but one thing that I would say is that we do have a lot of the requirements in place to actually do more for this. For example, from a policy perspective, we have a lot of policy levers. We have really good regulations that we just need to make sure that we implement fully. There's also a lot more knowledge around the economic levers. So we know, for example, the types of subsidies that we should be getting rid of, subsidies that we still have in Europe on fossil fuels, for example. We know more how we can encourage investment in green technologies and reduce lock-in to environmentally negative technologies in industry as well. And then on the ground, there's greater momentum towards delivering on some of these socio-technological levers, for example, around moving more towards electrification, increasing efficiency, and the value of green jobs as well. So I think there's a lot that we can do to actually, with what we have in place already, but we need to redouble our efforts and make sure that we actually deliver on these. And that brings me back to nature. And when we look at the European policy landscape at the moment, we want competitiveness, we want prosperity, we want resilience, we want security, we want health, we want fairness, we want good quality of life. And as I said at the start, nature underpins all of these elements, and it's up to us to make the right decisions so that we can, all of us individually and as a collective, live well within the limits of the planet. So read our report. Thank you.